Hi everyone, this is just a quick video to show you all the things that could be happening, could be acting on a patient while you are scanning them or putting them into the scanner. We refer to the scanner area, the MRI scan room, as zone 4. So if we have a patient that's on the table here and they're going to be going into the bore of the magnet, we have two main forces that are acting on that patient or that implant or any object that may find itself, any object that's metallic that may find itself in the magnetic isocenter or flux line area. All of these little areas in purple are the flux lines. So you'll see this way we're looking down the bore at the patient. Here we're looking sideways at the patient or at the scanner. So you'll see the first thing we'll talk about is translational force. And translational force is the pull that's going to be acting on the magnetic object or whatever. So if I have an object here, the closer I get to these areas here that have high flux density, and we call those areas of high spatial gradient. The spatial gradient's measured in Gauss per centimeter or Tesla per meter, but it's basically how quickly, what's the slope that the magnetic lines or magnetic field strength is changing due to the flux density. So you see out here, there's not a lot of flux density, so there would not be a lot of pull on my object. Whereas here, as soon as the flux density is changing, let's say from here to here, if I were to taking something through here, you'll see that there would be there's a larger change across space, and that slope of how quickly the magnetic field is ramping up. Because, you know, we have maximum like 3 Tesla here, and then at the place that the tech is actually sitting at, there is 0 Tesla, like, well, the Earth's magnetic field. So in between here and here, there is certain places that have a very abrupt slope. Those are the areas of high spatial gradient values. You'll see here there is, at isocenter, there is no slope because it's 3 Tesla here, 3 Tesla here, 3 Tesla here, 3 Tesla here. There is no slope. So the translational force on an object, if there is no slope, there is no force. So if you're ever in an MRI and you take a little paper clip, take it in to isocenter and just drop it. There is no force on it because there is no slope. There is no change. However, we have rotational force. And rotational force is what, if we have something with a long axis, if I were to take it inside of here, it would try to align its long axis to be parallel with the lines of flux. So if I took it here, it would try to align parallel with the lines of flux. If I took it here, it would try to align parallel with the lines of flux. If something were a spherical object, and I were to put it inside of here, there is no long axis, so there would be no rotational force on this object. However, because this does have a long axis, if I were to take it in, you'll see that after, it'll be a combination of translational and rotational force, but here you'll see the long axis here will align. So things are a little bit opposite. So for the translational force of an object, I would have the greatest translational force right here on the inside lip of my MRI machine, because that's where the slope, the change of the magnetic field is the greatest. So that would be my greatest amount of translational force. Whereas in isocenter is my greatest amount of rotational force. So if I had something and I had it in isocenter and it had a long axis, if I turned it, it would require the most force to be able to turn it, because that's the area where we have the maximum rotational force. Whereas here, around this lip, that's the area that we will have the greatest translational force. Remember, translational force is all about the spatial gradient value, whereas the rotational force, that has to do with the direction of the magnetic lines of flux, and it's the greatest at isocenter. Okay, this is just showing you a little bit more about a spatial gradient map. So you can see here we have, it's a little bit confusing in terms of how a spatial gradient map is shown, but you'll see in this case it's measured in Tesla per meter. So remember, 11 Tesla per meter would be 1100 Gauss per centimeter. 7 Tesla per meter would equal 700 Gauss per centimeter. And like I said, it's a little bit tricky. It's like a side quarter sagittal view. And so if we go to here, you can kind of see what this is. So I hope this makes sense. You'll be able to see, remember, this is the area that has the largest slope across space in the change in the magnetic field. So you'll see here at isocenter, there is no spatial gradient like we were talking about before. Let's open this up even a little bit more. There we go. So now you'll be able to kind of see that everything originally that we would see, you can kind of fillet it open and to be able to see kind of what this would be in 3D space, or at least 2D space flipped. So it can be a little bit confusing when it comes to your overall spatial gradient maps and things like that, but just imagine it like this and it becomes a lot more clear. So in this case, this MRI machine has a maximum spatial gradient of 10 Tesla per meter. So here's 7 Tesla per meter, 5 Tesla per meter. So if you flip it again, you could be able to see these different values on the other side, and it's all a mirrored image. And so if I had an implant that I could have, if I looked at it, it says don't go anything above 700 Gauss per centimeter, and I look and there's 10 Tesla per meter, I'm like, well, man, that's way higher. So this is the area that you would need to avoid. You'll see anywhere here there's 10 Tesla per meter. Here is 7 Tesla per meter. So if I had an implant that had only been tested or was only safe or conditional to 7 Tesla per meter, then you have to really avoid this area, anything on this area in space. So that's the thing that we're worried about when it comes to implants and what their maximum allowable spatial gradient values that they're allowed to be put into contact with are. At that point, you need to start to think about where the implant actually is inside the patient's body. Is it closer to the center? Is it closer to the periphery? If that's the case, if it's in the periphery, you might expose that implant, you will be exposing that implant to greater amounts of spatial gradient values.